The high cost of health insurance may affect whether you retire early or if you have to wait till 65 for retirement. We're going to look at two ideas here that can help you save money with your health insurance, so stay tuned. We're talking to Don this morning. We're talking about health insurance. Don's an entrepreneur, and he's looked into various ways of reducing his cost of health insurance, but high health insurance is a game changer for a lot of folks that are retiring. Can really make a decision whether they want to retire early or what type of a lifestyle they're going to live. So, Don, I want you to tell us a little bit about your situation and how you've reduced some of your health care insurance costs. What about your wife? What was her situation?
Yeah, now she's 10 years younger than me, so she was on regular health care insurance. I've always carried a high deductible health insurance my whole life because I don't mind the small stuff. I just wanted to protect myself from catastrophic financial loss. So I always carried $10,000, $12,000 in deductible. Her premiums got up to $1,100 a month just for her.
Just for health insurance.
Just for health insurance, only for her. So she had had some issues and so forth and so on in the past, and that was one of the reasons it was so high. This is 6, 7, 8 years ago.
They were paying $1,100 a month plus had a high deductible.
It's $12,000 deductible and $1,100 a month on her. Yes.
Okay.
She had had some issues. I had spent about $50,000 on medical costs for her over about a 7, 8, 9 year period. Still wanted to carry high deductible because if you didn't, the cost had been $2,500 a month, you know. Put her in the Christian Health Ministry program. A friend of mine had done a lot of extensive research on these Christian Health Ministry plans. And there are a variety of them out there, from Medicare to CH Ministries. That's the one we chose because they've paid out more in sharing dollars than anybody in the country, $3.5 billion. It's a Christian-based organization. They have an A+ rating with the Better Business Bureau. And the way it works, Richard, is it's not insurance. It's sharing. Members share costs. So if you go to the hospital and you have a $20,000 bill, then they negotiate that bill on your behalf. You have to pay it, okay? But then you're reimbursed through sharing all those costs. That's how it works.
So what is a monthly premium for Christian Health Ministries run?
$150 a month. I'm on the gold plan with her. I put her on the gold plan. That's the highest plan, unlimited sharing. So if you have a $1 million medical cost, it's unlimited. They will share all of that, and you'll get reimbursed all of that. Now, the wild thing about hospitals that I've learned over the years, if your bill's $100,000, you don't have to pay anywhere near that. Typically, we'll negotiate that bill down to $20,000 or $30,000. Now, if you have insurance, the insurance company negotiates with them. Yes, they will either negotiate for you or you can negotiate, and it's all shared with other members. So what I got her on is the gold plan and Brothers Keeper. Now, what Brothers Keeper is, it's a donation you make every month, completely voluntary, and they share all outside costs of things and help other people. So the total cost that we're paying for her is about $175 a month, share and reimburse everything. They've done so with $3.5 billion so far. Newsletters contain stories each and every month. They've never had an unresolved complaint. People going that route today, Richard.
Yeah, so $150 per month versus $1,000. That's a pretty substantial saving.
The newsletter they send you each month contains stories of people that have shared, $1 million bills and got
Right.
reimbursed for them. Absolutely, Richard. And if anybody that's watching this is going to get on that CH Ministries, their website is chministries.org. And my wife's member number is 238706. And the reason I give you that is as you share that with people, if you give them your member number, you get a free month. I've shared it with probably 10 or 15 friends of mine. I've gotten 10 or 15 free months.
Excellent.
So,
excellent.
that's always nice. And it's really a good thing for people who are healthy. Yeah, it's really, really good.
What about for yourself? You mentioned this Medicare Part B. How does that work for you?
Yes, you got two choices when you turn 65. You can either go on Medicare, and then Medicare pays 80% of the Medicare price. In other words, you go to the doctor and a doctor visit is $300. Well, Medicare marks that down from $300 to about $60.
Okay.
And they pay 80% of that. Then you're responsible for the rest. So that's where most people will buy a Medicare supplement plan that pays that 20%. So they don't ever have any out-of-pocket costs. Well, here's the problem with that, Richard. Those Medicare supplement plans are $200 and $300 per person per month.
Mm-hmm.
That's probably the highest cost insurance I've ever heard of. Because again, they're only paying 20% of what Medicare pays. So you have a $100,000 hospital bill with Medicare. Medicare marks that down to about $20,000. Then they pay 80% of that. Well, you're paying, $3,000 a year for them to pay $4,000.
Mm-hmm. Right.
I mean, it's crazy. So if you're healthy, now, if you're in the hospital a lot, if you're going to the hospital, if you're taking a lot of drugs, I mean, I would think maybe the Medicare supplement might be good because your out-of-pocket costs are zero if you're paying $3,000 and $4,000 a year in Medicare supplement premium.
Right.
But with Medicare Advantage, what I did, the premium is zero. They pay everything Medicare pays and more.
Mm-hmm.
However, you can have out-of-pocket cost of up to $4,900 a year. So example, you go to the hospital, your bill's $100,000. Again, they mark it down to 20 because Medicare, that's the Medicare payment. Medicare pays 80% of the 20, which is 16, and you're stuck with a $4,000 bill.
Right.
Okay. But you went 10 years and saved $3,000 a year. You saved $30,000. So it's kind of like high deductible insurance. I don't mind the $4,000.
Right.
I don't mind that. I'd rather pay $4,000 out of pocket every now and then than to pay $3,000 a year in additional Medicare supplement premiums.
Right.
Does that make sense?
That makes sense. Yes. Excellent. Okay, Don. Well, I appreciate you taking some time to give us some insight on ways of reducing our health insurance bills, our healthcare expenses with insurance. And I want to thank you for being on the air with us here today.
Absolutely, Richard. And if anybody that's watching this is going to get on that CH Ministries, their website is chministries.org. And my wife's member number is 238706. And the reason I give you that is as you share that with people, if you give them your member number, you get a free month. I've shared it with probably 10 or 15 friends of mine. I've gotten 10 or 15 free months.
Excellent.
So,
Excellent.
you know, that's always nice. And it's really a good thing for people who are healthy. Yeah, it's really, really good.
Excellent.
Okay.
Well, Don, I appreciate you sharing ways to reduce health insurance costs.
Okay, Richard.
You have an excellent
Always,
day now.
always good to talk to you. You too.
Yes. Thanks a lot. Okay. Bye now.
Bye.